Today we'd like to have a small, brief discussion on the urinary issues, which are major concern in elderly patients. The reason why I have chosen this topic is because majority of the men as well as females after the age of 50 years, they do have some kind of a urinary symptoms, and many of them they feel that it is all age related, and most of them they don't see a doctor as in the beginning of their suffering. They tend to wait and try to treat themselves rather than coming to and seeing a doctor and delaying the treatment. I would like to have brief this one on why and what are the symptoms of these urinary issues. So as we grow old, after the age of 45 years, like you see there are external changes and internal changes which take place in the human body. Externally, you can see graying of the hair, thinning of the skin, reducing the fat, bulge over the waistline, other things which are like hearing loss, eyesight, reduction in the eyesight. These are a few things which you come across. Similarly, there are changes in the internal system also. For example, heart try to become weak, you trying to forget few things because changes in the brain. Similarly, there are things which take place in the urinary tract also, which will lead to symptoms like urinary symptoms, which we'll be going through in detail, so that people can understand what are related to the age-related problems which are taking place in the kidney and how to notice them and consult a doctor so that it can be treated in the earlier phases to reduce the burden on the family members as well as quality of life of the patients. So here you can see we have two kidneys. Okay, the whatever the urine is produced in the kidneys, the urine comes through a small tube called ureters, which are about 25 to 26 centimeters long, and the diameter of these tubes is about 3 to 4 millimeters. The urine from both the kidneys is collected in the bladder, and from there the urine comes out. Up to this level, it is common in both men and female. If somebody as you grow old, most of the patients do have the following diseases. For example, diabetes, Parkinson's disease, Alzheimer's, stroke, cardiac problems, obesity, immobility. For example, in diabetes, the number one symptom in diabetes is many men tend to get up few times at night. So in prostate, it is like a double impact. Patients who are suffering from urinary problems, if they are associated with diabetes, there is 1 plus 1. So because of this, if you don't control diabetes, the problem worsens in patients who are having diabetes plus urinary symptoms. Similarly, patients with Parkinsonism, now this disease is becoming quite common after a year of 50, 60 years. You must have come across many patients who are having these diseases. What happens in Parkinson's is the mobility of the patient, the coordination of the muscles become abnormal, and because of that, even if they want to go to a toilet immediately, they cannot stand or reach the toilet. And because of this, if they are suffering from urinary symptoms, they tend to wet their clothes before reaching the toilet. Is because of the coordination of the movements, they tend to have either constipation, and because of this constipation, there can be a similar impact on the urination as well. Same with Alzheimer's. Because of the neurological association, the bladder tends to work in a different way, and this will have an additional impact on urinary symptoms. If somebody had a stroke or paralysis, in paralysis what happens is the nerves which are supplying the bladder tend to either overactive, or in some patients they can be hypoactive. Hypoactive means the nerves may not function the way they should be functioning. So because of this, the bladder might become weak and it will increase the chances of not emptying completely. And if the bladder is not emptying completely, there is a possibility of retaining urine, which may lead to urinary infection. Patients with cardiac problems. Many of the cardiac patients tend to either they restrict the water intake or they are on tablets called diuretics, which will increase the urine output. So if somebody is suffering from already urinary tract infection because urinary tract symptoms because of prostate or other problems, if they are taking this medication, again there is a worsening of symptoms in patients who are on these medications. Obesity nowadays it's a quite common problem. I've seen come across a lot of patients who are obese. Because of their obesity, their mobility decreases and they tend to have these urinary symptoms because of the immobility. They tend to take some time to reach the toilet. So because of this, it leads to and there's a weakening of the pelvic musculature can lead to leakage of urine. So they suffer a lot of embarrassment when they go out there. So because of this, they tend not to go out of the house. They remain inside the house, so which will worsen their psychological issue as well as emotional issues. Same thing applies to patients who are having spine related problems, or if the patient had a recent fracture of the hip or knee, they bedridden, and this will worsen the symptoms with the urinary tract symptoms. So what are the symptoms we come across in patients who are elderly? So I'll be explaining to you each and every symptom of it. They are written in a medical term, but I'll be explaining to you in detail in our layman's language. Most of the patients, elderly patients, without their knowledge, they tend to go frequently to the urination. Frequency means if somebody is going to loo more than 8 times per day is called frequency. So they tend to visit the toilets every 45 minutes to 1 hour. And they feel that it is all age related, but they normally don't try to see a doctor. What they normally do is they tend to decrease their water intake. Suppose if they are drinking about 2 liters per day, they hardly drink 3 to 4 glasses. If they reduce it to 3-4 glasses, suppose if it is a summer like this, they develop urinary infection, which will complicate the urinary symptoms. So many of the old elderly people, this is what they do it because they need to go to loo frequently. They will reduce their water intake. The next symptom is urgency. What is urgency is whenever you feel like passing urine, the moment the urge comes, you need to rush to the toilet. So that is because there is irritation in the bladder, and because of this, normally which before 50 years you can wait for some time. Once you get into these symptoms, you won't be able to wait longer. If you wait, there is a possibility of you leaking into clothes, or by the time you open your toilet door, you will be passing urine. After the age of 50 years, normally it is about once you may get up at night to pass urine. But patients who are getting up 3-4 times, that is called in medical terms as nocturia. So if somebody is getting up few times, it will disturb their sleep, and then which will cause a lot of irritation, emotional imbalance. So these are the symptoms which have come across in elderly patients. Incontinence. Incontinence is urine leakage without the patient's knowledge. It can be by the time he reaches toilet, it can be incontinence, or whenever they cough or sneeze, there can be leakage of urine, or when they are sleeping without their knowledge, they may wet their bed. So these are different forms of incontinence. Various patients will have different combinations and permutation of these symptoms. So we need to assess and then come to conclusion that what is causing this incontinence. The next is the hesitancy, where the patient goes to toilet, but he tend to wait for a long time to pass urine. Suppose the moment they go, they should be able to start passing urine within few seconds. But in certain patients, they tend to wait 1 minute or plus, and then slowly the urine starts coming out. In between, they need to force themselves to pass urine. That is called intermittency. And after passing urine, they may not feel that they are emptied completely. They feel like going to loo again after 5 to 10 minutes. So these are symptoms which many of them they do have, but they don't see a doctors on a regular day immediately. Next is the reduced urine flow. As you grow old, the flow which they had it about when they are 30 or 40 years, it will be almost half of that. But elderly patients, they feel that it is age related and they don't tend to take advice from their doctors. So this is one of the major symptoms please consult your doctor if you are going through all these symptoms. Certain patients, they can directly see, they come across, they don't tend to present with all these symptoms, and directly there will be complete blockage of urine. So the number of patients come in this category is about 5 to 10%. Few patients, they present with a recurrent urinary tract infection, or they can be bleeding in the urine. And there is about 5 to 10% of the patients, even in spite of having all the symptoms, they feel it's just age-related and they don't see a doctors immediately. Majority of the time, the relatives, either the son, daughter, or they see them going to the loo frequently, or they see them leaking in their clothes, and then they ask for advice. So nowadays, it's quite common. The moment they feel that they have some symptoms, what they do is the easiest way, they tend to go to the Google and try to treat themselves. They do all sorts of research, spend almost every day few hours on net and try to treat themselves. I think that's not a good sign, because recently I came across one patient. On a regular basis, he was wasting 2 to 3 hours trying to sit and do a research on Google, and he was doing something else which he had something else. So it's not, please don't do that. Even if you have a small symptom or small problem, kindly consult your doctor rather than going for Google advice. Any patient who is having these urinary symptoms, even if it is age-related, slight difference, it is advisable to see a doctor. And once you see a doctor may not ask you for a major investigations. At the most, he may ask for a routine urine investigations, and depending upon that, whether you have diabetes or not, maybe some blood investigations, and the last one only sonography. These are basic 2-3 investigations which are required to see what exactly is happening with the bladder and the other organs there.